Alaikum. Very warm welcome to the Informative Glue by Dr. Hafiz Sanaullah Zakir YouTube channel. Today our topic is about antidepressants and antimanic drugs. So please watch the video from the beginning till end. Let's start. First of all, we have two terms, depression and mania. Depression, the symptoms of depression are feelings of sadness and hopelessness, and the inability to experience pleasure in usual activities, loss of energy, and changes in sleep patterns and appetite, etc. Okay, so those drugs which are used to reduce the symptoms of depression are known as antidepressant drugs. And while mania is enthusiasm, anger, and repeat thoughts in speech patterns, and extreme self-confidence and unpaired judgment. And those drugs which are used to reduce the symptoms of mania are known as antimanic drugs. So first of all, we will come on the mechanism of antidepressant drugs. Most antidepressant drugs potentiate directly, either directly or indirectly, the actions of norepinephrine and serotonin in the brain. Along with other evidence, these led to the biogenic amine theory. The biogenic amine theory proposes that depression is due to the deficiency of monoamines. What are monoamines? Mean deficiency of monoamines such as norepinephrine and serotonin. And the other term, mania, is conversely caused due to the overproduction of these neurotransmitters. These neurotransmitters are norepinephrine and serotonin, due to the overproduction of these neurotransmitters. So mania is opposite of depression. In mania there is overproduction of neurotransmitters, while in depression there is the deficiency of monoamines such as norepinephrine and serotonin. So, but this biogenic amine theory of depression and mania fails to explain the time course for the therapeutic response of these neurotransmitters, because it will take several weeks, and while the pharmacodynamic effects of the agent is immediate. Okay, so now we will come on the classification of antidepressant drugs. Due to the shortage of space on the whiteboard, I wrote in the form of abbreviations. First subgroup of the antidepressant is selective serotonin reuptake inhibitors. The second one is serotonin norepinephrine reuptake inhibitors. Third one is atypical antidepressants, and the fourth one is tricyclic antidepressants, and the fifth one is monoamine oxidase inhibitors. Okay, so I will tell little bit about the drugs from these. Each subgroup contains its own drugs. For example, in the selective serotonin reuptake inhibitors, the drugs include are such like citalopram, escitalopram, fluvoxetine, fluvoxamine, and paroxetine, sertraline, etc. Okay, and in the second one, serotonin norepinephrine reuptake inhibitor, the drugs are present which are venlafaxine, disvenlafaxine, duloxetine, and levomilnacipran. In these all subgroups, such like drugs are present, and you should remember each subgroup drugs. Okay, so now first we will come on the first one, selective serotonin reuptake inhibitors. First of all, I will tell you people the mechanism of action of the selective serotonin reuptake inhibitors. These selective serotonin reuptake inhibitor drugs inhibit the serotonin reuptake, having 300 to 3000 fold greater selectivity for the serotonin transporter as compared to the non-epinephrine transporters. Okay, and in the after that, a part in which actions are present, the selective serotonin reuptake inhibitor block the reuptake of serotonin, leading to increased concentration of neurotransmitters in the synaptic cleft of brain. Okay, in the B part we will read the therapeutic uses. For what we use the selective serotonin reuptake inhibitor drugs. These drugs are used for the obsessive compulsive disorders, panic disorders, and also used for the generalized anxiety disorders, and also these are used for the post